Very good evening, my beloved colleagues, for today. Our agenda today, already you know that it is just to have some ideas, those who passed AKT, and hopefully other colleagues also will join. I have contacted with them just a little bit, few minutes before. Yes, Dr. Javed is here. Welcome, Dr. Javed. Uh, Yet to connect. So, but those who are there and those who didn't pass or planning to appear the exam, it will be more useful. For this reason, we are spending our time, few minutes here. And a few colleagues already I have seen that possibly are planning for the exam. And we are trying to be connected with each other. My observation of the exam is that the exam is day by day being improved. Profile is improved. Dr. Mahmood is here. Dr. Mahmood from Sudan. Dr. Mahmood, sorry, is yet to join. In last 1 year observation, I think our colleague also will tell something. The question pattern, target of the question is actually being changed. Now, it's not that like 10 years, 12 years before. What I like to mean, you're just reading a Christian bank, for example, Past Medicine, AKT, or on examination.com, or many other sources you are reading. Only just reading will not be enough to pass. You know that the exam already recognized by, very simply to say, UK as well as Australia. So UK and Australia recognize it means actually the MRCGP South Asia recognized throughout the world. So the profile, the vigor of the exam should be maintained and will be heightened in future. For this reason, our beloved colleagues are requested to be updated. So from our side as organizer, we are trying our best to invite you for the different with the different issues to communicate. And today it is very exceptional and great chance to invite our colleagues, those who were with us before in their preparation. Definitely they are happy, we are happy. And we, first of all, actually, we praise to Almighty for everything. But your journey is not finished here, those who passed. Your journey just started for the MRCGP. Your remaining is the second part, practical part. So we will be with you in future by the mercy of Almighty until you pass the OSCE as well. But today we like to hear from you. Uh, our colleague can talk also. This is very homely environment. Anybody can open the mic and ask the question. But may I request Dr. Nasir to initiate the talk with us in the exam, in your significant journey of the preparation? What did you observe? Actually, I was saying by my talk, Dr. Nasir, do you like to say something different or with actually like me? Dr. Nasir, can you open the mic, please?
Yes, sir.
Please, Dr. Nasir.
Yes, sir. First of all, Assalamu alaikum to all the colleagues and Dr. Usman, and thanks to Almighty Allah. Actually, this was my second attempt. I appeared two times before in MRCGP AKT, and at that time, the passing score was very high, and it was almost my mistake. And when my result came, I discussed with Dr. Usman, and he told me, Dr. Nasir, just give me one answer. He asked me, Dr. Nasir, are you preparing for another exam? I said yes. Actually, at that time, I was appearing both, and preparing for MRCGP AKT and MRCAM, member of Royal College of Emergency Medicine, primary part. Uh, but the good thing was that I passed MRCAM primary at that time. And at that time, Dr. Swan told me, Dr. Nasir, please concentrate on one exam. And this time, I only concentrate on MRCGP AKT, and Alhamdulillah, I passed my exam. And I uh, just request all the colleagues who will appear in MRCGP AKT. My dear, you will maybe most of the colleagues told you that just take a online subscription of past medicine and you will pass. No, my dear, this is not the way. As Dr. Sman told us right now, that nowadays the exam is more harder than before and more oriented exam. Anyone cannot pass with only past medicine or any other. I saw so many courses are available in the market. But Dr. Sman course was exam oriented, comprehensive, and very focused course. You don't need to go any other, even not a single MCQ. I did not do anything else except Dr. Sman course. Just take a subscription and go step by step. Don't, even Dr. Sman told me, Dr. Nasir, skip the optional MCQs. I only target Dr. Osman lecture, then slides and MCQs and mock. And especially, you cannot find the pictorial, the X-ray and ECG and past recalls. Yeah, nobody can find all these stuff in any course. So, my dear, if you want to pass in one go, simple as that, just take Dr. Osman course and inshallah, hopefully you will pass. This is all my journey.
Thank you, Dr. Nasir. You appreciated us, and it happened so for you. We are very happy to know. But the guidance already you started that the double preparation. Now I can recall what I said to you. That yes, I just now recall that don't go with for the preparation of two exams together. I don't know anybody having the same experience here. Dr. Javed also here. Dr. Javed. Uh, and I found that most of the colleagues, they are not much junior throughout the world. They are mature enough. They are on the middle of postgraduate degrees and others. And I was thinking so, there might be some less attention. What is the practical reason that I found with Dr. Nasser? Yes, you are right. So those who are here listening now, our suggestion will be the just to go with one. You can study the topics, no problem. And it happens so even in my life also. The MRCP, MRCGP, I started for the MRCP first, though many years before. But when I thought that I would appear in the MRCGP first in the exam, then I just spent few months specifically for the MRCGP, that is for the AKT. And this is very practical. You don't think that I have the knowledge and I am up to date and I can pass. It is very less realistic. Every exam has some its own technique, peculiar style. Then you have to adopt it. So, Dr. Nasir, thank you very much for a very nice technical suggestion. And others actually goes in favor of us. This is from Almighty. We have done our job to prepare you, to guide you. That's all. I don't like to say about these our materials and others. Those who are utilizing, they know, and that's all. So, Dr. Nasir, take some rest. If any colleague asks a specific question, I think you can join with us. Dr. Javed, can you hear me, please?
Yes, yes, Doctor. Assalamu
Yeah,
alaikum, Doctor.
Dr. Wasalam, and again, just little flower with you, Doctor, in the screen, not in live, and you cannot take the flavor also.
Yes, Doctor.
Mabruk,
Yes,
Dr. Javed. Mubarak ho,
uh,
Dr. Javed.
And other colleague I informed, and few Sri Lankan colleagues also. Really, I forgot the name. Actually, I don't have a specific record. Sorry to say, by name and other. Dr. Nasser also asked me who are actually passed. I could remember few names. And few colleagues already they have started our OSCE preparation and from Sri Lanka. Anyone here, Doctor, a Sri Lankan colleague here? Just to congratulate you, nothing else, Doctor, give our chance. Dr. Abu Mahmood raised the hand. Dr. Javed, can I invite him, Dr. Abu Mahmood? Yeah,
sure,
we
Doctor.
can talk later. Any Sri
Okay.
Lankan colleague, please? If you join and passed, You can introduce yourself. Okay, Dr. Abu Mahmood, please welcome. You can open the mic, please. Dr. Abu Mahmood, you
Yeah,
raise.
Assalamu alaikum, Dr. Osman.
Aslam. Yeah, Dr. Mahmood, you are from
Uh,
Sudan.
yeah, I'm from Sudan, yeah, Doctor.
Yeah, Dr. Mahmood, congratulations to
Yeah,
you also.
thank
Congratulations
you
to
so
you.
much, Doctor. See, really, just I want to congrat for my colleagues also for pass for this exam. I also my colleague also he told that now this is very now become very difficult exam really. Also for me also this is a second attempt also. But just I want to thank you, Dr. Osman. It's not in front of all my colleague, but this is really what happened yeah, for me. Yeah, this is very useful, really, very useful course. And for me also, this very also systematic course also. I don't need to anything out of the course, really. يعني like
Alhamdulillah,
this mock,
Alhamdulillah,
yeah,
Alhamdulillah.
yeah, this systemic mock exams and also these recalls, this very beautiful and very useful lectures. يعني really, it's very nice. And also for me, يعني I feel you are my friend, not my doctor also. Because
This is our
يعني for
pleasure,
our,
doctor. This is our
yeah,
pleasure.
our,
I didn't say
yeah,
that I
for,
am teacher anytime. Nobody can say I was
yeah,
teacher to anybody.
oh, really, I found you are very close to me, really, Dr. Osman. This is what might happen because also when I faced this very difficult time when I passed my father, also you are support me too much. At that time, I feel you are very near for me. Maybe I know you maybe before 15 or 20 years before. So you are very friendly, like the doctor. So our lectures also very useful and very easy يعني I don't know يعني really I cannot do يعني say anything better for you not
May
enough
may
really not
Allah
enough
accept,
Dr. Osman.
doctor. May Allah
Yeah, and
accept
also
all
that
of your good
I want
wishes.
just to tell our friends also our colleague that your recalls for how to deal with the questions also it is very useful for me because you are make the question by maybe 4 or 5 10 sides also how to know this question how it is come how to solve this question also by several ways. This is very I think very intelligent. I think this is not found in maybe any lectures also يعني this really it's very useful for me. And
Okay, doctor.
so when I faced this exam, I remember you, your advice and your lecture and your voice also in my exam also really it is very useful for me. Thank
So
you so much, doctor.
that means
Yeah, thank you so much.
sorry to say to ask you, were you hallucinating my voice in the exam time?
Not understand. No, but yeah, really, it is very useful for me. Thank you. I don't know يعني إن شاء الله by Arabic يعني جزاك الله كل خير إن شاء الله دكتور عثمان.
Shukran, doctor.
Really,
Shukran.
really.
This is our pleasure. But I am excited to know. But the thing is that just my humble addition here. What do you say, Dr. Nasir? Also, the extraordinary part of the preparation, other than question bundle, like from past medicine or others. It's fact. Actually, I didn't search anywhere. For example, the authors of or the question bundle of past medicine, AKT, past test. Recently, what they are doing, and do they have the recall discussion lively and the what else? Many other thing, learning materials, system wise PDF that is actually from our mind that as a part of you as you said that actually myself feel as a brother, possibly senior brother, and I was thinking that it could be helpful, and that is done accumulated in the module. But Dr. Nasir and Dr. Mahmood also as well, if any new things comes in your mind within few minutes today also you can share anytime. So let's wish Dr. Taslima here, please. Dr. Taslima. Welcome, Dr. Taslima. And it's very glad that Dr. Taslima is staying in Pakistan now. But she is from my native country, and it's a very pleasure to introduce her. Dr. Taslima, please, can you say some words? We congratulate you. Any problem opening the audio, Doctor?
Assalamualaikum.
Assalam. Please, Dr.
Sir,
Taslima.
hope hope all of you are doing fine. Um, thank you very much. Um, uh, Actually, this November attempt was my first attempt, and Alhamdulillah, I cleared. And uh, it's it was a um, what will I say? Uh, a kind of experience. Because I took a very short period of time to take preparation for AKT, so I was very um I'm not I was not sure I can through it or not, but Alhamdulillah, I cleared it. And thank you very much, sir, always for your kind support. And I
Nice, Doctor.
also followed your module before. You know, I tried to take preparation before, but few for some of my others issues I could not appear. Uh,
Yeah.
but yeah, uh, your module was also that time I followed, and it was great. So, uh, anything specific, sir, you want to know regarding the preparation? I don't know.
Yeah, one
Um,
thing already we started from the beginning
yeah.
is possibly you passed recently, but many doctors thinking to appear the exam not very within 3 months or 4 months, near about 6 months to 1 year before. Usually, doctor starts
Mhm.
to think to appear the exam. In the
Yes.
meantime, what did you observe? Suppose you thought 1 year before or 2 years before that exam is like that. Did you get any change of exam system recently after appearing the exam? What is your observation?
Uh, I actually did the recalls from 20 to 25 May. And the thing is, yes, this time after giving the exam, the thing I noticed that the question pattern may be change. Like, okay, whenever we are taking we were taking preparation, then okay, if there is nothing common, or okay, in this situation refer, we are GP, so there are certain cases we have to refer, or maybe we don't need to study it up to that much, because we will refer this patient. But this time, mostly they ask for treatment. It's not like specific for GP settings. So it's after giving the exam, everyone was talking like, okay, it's like MRCP exam. It's not feel like we give MRCGP. That's a thing, I will say, because mostly I will say the treatment oriented. We are not going to treated this patient in a GP setup, but we have to know the treatment, and they're asking for treatment. They're asking for the advance um, uh, things which will be done by
Modalities
the,
of the
yes, yes,
management.
which
Yeah.
actually going to be done by the specialist, but
Yeah.
they're asking. So I think the the question pattern is changes like this, the RCGP. Uh, so they want maybe us more efficient, more to know like this.
Yeah, Dr. Taslima, be with me few 1 or 2 minutes, please. In the meantime, we got the message in the chat box. If you could say, Dr. Nasir commented that uh, to concentrate on the common diseases. This is the main message for GP or family medicine exam. An exam is clinically oriented. I think everybody will agree with this. Dr. Taslima, as you said that this is a MRCP like, rather to say, I don't know, did you forget or not? When you started talk to me before that, when you could start or not, not very recently.
Long
And
before.
I advised you to come with our MRCP Part 1 courses. We still didn't
Yes,
prepare
yes,
AKT at that time. You
yes,
encouraged
yes.
me at that time that please you can prepare for us MRCGP AKT. I can remember. And that was my forecast at that time. The MRCGP exam actually going to be allied with the MRCP, but though there is a distinction, there is a separation. And why they ask about the question of the answer to be done by specialist, I like to add for the benefit of other people, preparation group or other colleagues here. Whenever you face the OSCE, you are actually creating or preparing your bases in the AKT learning. In the OSCE station, those who appeared or have seen in the YouTube also, whenever a management comes, simple de-shouldering is not enough. That I am sending there and I become relaxed. It is not that. And whenever you send the patient to any specialty hospital, you need to give an explanation why you are sending there, what they could do. You don't need to be very scholar, very master of the management to be done by the specialist, but you should say they will do something. For example, for the MI patient, they will give some injections, they will give oxygen, they will put you in a special room. You must know it. Not that I am GP, I will not manage the patient for acute myocardial infarction. I don't need to learn. It is not so. I think Dr. Taslima opined as such, what I understood. And this is very important. Referral knowledge must for the GP, no doubt. So if you know the referral knowledge, after referring, what treatment could be done, minimum basic principle should be known. For this reason, what Dr. Taslima observed, I actually in the same opinion. Thank you, Dr. Taslima, for your joining with us in the talking. And recall, Dr. Taslima again wrote here, recalls are very important. Yes, recall important, and we remain very vigilant. We are not missing in the last many diets. Immediately after the exam, we were inviting you. Most of you possibly attended the recalls. And the technique of recalls, this is our job as a mentor, as a guide, how to study the recall. It is not just having a list. This is the topic, this is the topic. There are different angles are there. Topic is same, but angles are multiple. Okay. So I hope that those who are reading and following our module, you are enjoying the recalls as well. Dr. Taslima, do you like to add any more? Dr. Taslima, please. No more? Okay. For the first round up to this from Dr. Taslima, and I was actually searching any colleague from Sri Lanka to comment here before going to Dr. Javed. Dr. Javed, please, you can please follow us now.
Yes,
We
Dr.
could listen from other later, please.
Yes, Dr. Usman. Actually, I congratulations to all colleagues who have passed, and those who could not should remain calm and keep the preparation going. And I actually, to tell you the truth, I studied only from your course. First, before
Alhamdulillah, it's good
yes,
to know.
to some extent, this Oxford Handbook of General Practice. But in the last 2 months, then I only concentrated mainly because time was not enough. So I was only concentrating, and in fact, I will tell you that your course covers everything. You don't need to go move around past medicine or any other material. It covers everything. I think you don't find the time to go here and there. So it covers each and everything. And I took your course almost, I think, maybe 5 months or 5.5 months before 19 November exam. And Alhamdulillah, I passed in the first attempt. So it's good thing that you don't have to look to different materials of MCQs. And what I felt in the exam, that basically exam is not very difficult. And if you have clear concepts, and you mashallah, what you did is to you make the concepts very clear. I mean, your lectures are interactive and interesting, and MCQs also you make very interesting. Plus the recall session, I was not able to do all one, because better to do all recall session. Plan your revision according to your schedule. But I was not able to reach that till the recall session. I think it was almost to the last day, second last day, or so. But overall, I think under one roof you can cover everything. So, uh, thanks a lot. This is all because of you.
Thank you, Dr. Javed, and Alhamdulillah for everything. But again, our expectation is that those who especially passed, and you will be busy for the OSCE preparation, no doubt. But our humble suggestion, very kind expectation from you that if anytime, if you have any additional thing we need to add to the module, we will be very happy to know. We will be very grateful for to you actually, and we don't like to increase the bulk of the preparation. It is also true. Many often we discussed thousands of questions available there in the past medicine or other, what I like to say, other source question bundles. So it will kill your time. And we started the talk from the beginning. Only reading the question bundle is not enough. You need to prepare yourself in many ways. I like to add something that, fortunately, rather to say, I'm actually trained up for the teaching methodology, and somehow I was trainer also in my job place in the medical college. So it is very easy for me to use the techniques in the teaching. I couldn't actually do each and everything. It is human limitations, but I tried my best from our side. My team also helping hands, and those who are suggesting to improve this thing. That is, I told that Dr. I remember Dr. Taslima. She is my country woman, rather to say. She was also advising at that time that, sir, can you please create a module like that? At that time, it was expected to be live classes, but for the COVID and others, we turned into the online classes. So that is the thing, and wastage of time also important issue. Wastage, I like to say that if you read 5,000 question and the past medicine on exam, they will increase more question. I think it is part of the business issue also, rather to say. Otherwise, what magic they will show you? Dr. Javed, if I say the word, possibly I am not wrong, they need to show some magic that they added something there. But the concept already you developed, what Dr. Nasir also opined, it is very important. The answer will be given from the concept. And it is very true. Myself as a mentor, as a colleague of you, I was also learning many, many things. If I or our team couldn't be busy to prepare the module, I will be out of many, many knowledges. So this is my gratitude as well to all of you. And I remember Dr. Javed, Dr. Nasir, Dr. Taslima, and many other colleagues, they were very regular with us. Recently joined Dr. Mahmood from Sudan, as he said. I have contact with him not even 1 year also with Dr. Mahmood. So those who appeared first time, don't be frustrated. No problem that you couldn't pass. It is a part of the journey. It is not only thing, only achievement in our life. It is a journey continuous until you reach your pass. But after passing also, you have responsibility as a professional, no doubt. So AKT is actually very base to prepare yourself from the knowledge part. All of you already got the knowledge in for the next time for OSCE. So we hope to sit with you, Dr. Javed and other. If you need personally, anybody can talk to us, and our door is open to freely. You can talk to us. Those who passed AKT already for your OSCE preparation, and for AKT, actually, those who are here listening, they're very enthusiastic and serious to know from you. Already you said that your preparation is okay and you were busy with our module. But any other colleague also, those who are here and we don't know that your status, did you pass or not? Other colleague, other than those who talked till now, do you have any query now, Doctor? Dr. Javed and other also can answer on behalf of me. Any other colleague, any doctor, please, you can open the mic and ask, please, for a while, if you want to know from the exam. You were thinking. So may I ask the question? Dr. Javed and Dr. Nasir, those who appeared exam, you can answer. Dr. Javed, can you hear me?
Sure, yes, I'm listening.
Yeah. In medical teaching methodology, we say the X-ray, the ECG, and the investigation reports, we say as instruments. Instruments. So if I say what instruments actually appeared in the AKT exam, is it X-ray ECG only or more than that? Can anyone recall as well as Dr. Javed? If I say, were there any ultrasonogram report by picture
In this exam, I think X-ray and ECG.
only?
Yes, but
And this
not
is true. This is true. This is
not,
true.
maybe in the other exam will come or
Yes,
before.
yes, yes. As we have gone through also their rules, regulation, and the exam content, I have seen it also. The X-ray and the ECG. It means all colleagues should be very well conversant about the X-ray and ECG. It is not only that report given by other radiologist, report will be given by cardiologist. It is not enough for your practice. You must know it. For this reason, we develop some basic classes. Already records are available, and most basic classes are available in the YouTube. Anybody can see it there. Basics of the chest X-ray, basics of the ECG. But we segregated separately for the AKT and OSCE exams some special pictures, those who are actually commonly appearing in the exam. This is a separate thing, very less time, but there was a very big sessions. I remember we took around 5 sessions of ECG and X-ray maybe 2 or 3 sessions. 2 session maybe there minimum. So these are the special thing you must know, and that you will find another colleague also, Dr. Javed. I think these type of discussions are not much included. The author of other sources, they can give only text. They cannot give you a live discussion even in the record form also. It is not possible because they are not sitting with you together. Isn't it, Dr. Javed?
Yes, yes.
So for this reason, you need to
Very
sit with
friendly.
someone. Yeah, Dr. Javed. Dr. Javed, to say any more?
Yes, I said because I mean interacting with you is very friendly also. So the person and
This
very
is
easy.
our pleasure, Dr. Javed, that we became friend of you. This is our pleasure. May Almighty help us. May Almighty help us. Dr. Nasser also possibly to add. Yeah,
Yes, sir.
please.
Sir, by telling these techniques, maybe you give business to pass medicine on examination. Maybe the next time they will include some lectures of ECG next and tutorial.
Oh my God, I can remember one memory to you, maybe 3 year or 4 years before. I'm sorry to say, just other colleague listened to me. And most of you have seen that in our description explanation, we have given the red mark. Dr. Nasser, please be with me. And Dr. Javed also.
Yes,
When actually we tried our best to go through all the text there and given in the red mark, the keywords. Can you remember the keywords when we discuss a
yes,
question?
yes, sir.
And it was actually newly thought of us. We have given it in this year. I found in the past test, they have created this thing with the keywords given in the yellow color, maybe. I
A
don't
good
know
competition.
what it is. I'm sorry to say they are a very big company. I cannot say I'm competitor for them. That was happened to us really. I was thinking every doctor should identify the keywords. How we thought from there. You know that in our clinical case in the bedside, after taking the history, after taking the examination, what we do, we create a salient feature, is not it? Dr. Javed, if anybody can open the mic, keep open, please. Dr. Javed, Dr. Nasser. We create the salient feature, isn't it? To make
Yes,
a
sir.
summary.
Yes,
In the OSCE also, you will do the same. The last word, those who observe our video record, you have to say to the patient that, so far I understood from our talk and after examining you, you are having such thing, such thing, such thing. There, so I am thinking you are possibly suffering from irritable bowel syndrome or like that. This is the summary. So to make a summary, what are the key words? That was our thinking. And we introduced in our actually discussion class and others in the projection in the multimedia slides, PowerPoint, it could be the keywords. I think all of you remember the red mark keywords are there. This is important. And those who will be even, okay, you will be family physician, but maybe in other subject, you will be resident in the hospital. When your consult will come to see you, to make a round for the patients. Consultant will not be with you 10, 15 minutes together for one patient. He is very busy to see the case, maybe 3 or 4 minutes he is to spend, he or she. But you are a junior assistant registrar or registrar, clinical registrar. You have to accompany the consultant and give a brief to the consultant. So my suggestion in my college also, I tried my best to my very junior colleagues, those who are students and even the junior doctors, try to finish your case within 1 minute. How to do it? Only by practice, understanding, listening, thinking, what could be the key words. That is very important in clinician's life. That we tried. Thank you, Dr. Nasser, also to
Uh,
remind me
as
this thing.
Dr. Usman,
Yes, Dr. Javed.
people are afraid that time will be less because me, I finished maybe about 20 minutes before. Then I put flag questions, but normally in the first attempt, what you are thinking, put that. I mean, you have to mark better to mark that question and put flag. I mean, to reconsider only few. I put about flag to 10. So that 10, I know that maybe most of them were wrong afterwards because like this Dr. Nasir make right. One question was I think about grade 4 hemorrhoids management. So I put band ligation. Dr. Nasir, you were right. Afterwards I checked in the books. It is should be hemorrhoidectomy, surgical
Yes,
hemorrhoid.
Dr. Jan.
In
And
our
you are
recall,
very right.
in recall class, possibly you discussed on that day.
Yes, yes.
Yes,
So the
yes,
first whatever come to your mind, better to click that.
Click that. Yes,
yes.
it is true.
Never,
Psychologically, also, it is true.
never repeat, never change the answer.
No,
Never change.
rarely you could change when you have the time later, then think back. Okay, I will. But most of the time, when you are thinking the first time, this is the correct answer. It is very, very true. It is true.
What about
Yes,
try to keep? I mean, try to keep some. I mean, 10 minutes or 20 minutes
Yes.
till the
Mm.
end. I mean, don't go till the end. Your 200 questions finishing and your time is finishing. Better to finish 10 minutes
Yes,
before.
yes, definitely, definitely. So,
yes,
what we advise all the time, even in the mock also, we have allocated 1 minute for one question, not more than that, right? If you give 67 question in the mock, system-wise mock, we allocated 67 minutes just to orient you. Okay, that is the way. And few candidates couldn't pass. The reason is that they were thinking more in the middle with some questions. They couldn't reach question number 200. And it happened. It happened. And our experience also that in the later time, usually somehow how the miracle comes there. The last questions were very easy. Question
yes,
number
sir.
199,
Very right.
198, usually easy. So they use our psychology also, the examiner, that even you cannot make the question answer correct. You become puzzled in the middle part, you busy with very critical questions. For example, if you are not well oriented with a statistics question, usually a statistics question needs more time sometime to calculate something. So you sometimes you need to spend 5 minutes for one question. It will be not cost effective.
I spend more time on the
Yes,
statistics.
yes. So skip it.
But still, I was not sure it is correct or not. But
Skip it. Just skip it and keep a mark there in the question paper. If possible, I will come back there. Just give a symbol or something that I couldn't give correct answer there. I will come back. But don't keep pending, right, Doctor Javed?
yes, yes,
Don't
sir.
keep blank. You give one answer there, and then make question number, for example, 132. Make a pencil mark there. Sorry, pencil mark is not possible in the online system. In
There
the
over is actually in the schedule was there that if you want to reconsider,
yeah,
you can flag on that.
Yes, flag on that. Yes. If there is a possibility of flagging, you can make a flag there.
Was that you could put flag, and then if you come back, just reconsider the
Yes,
flag.
reconsider. This is the thing. So those who are appearing newly, try to remember today's discussion. What do you have to do or you can do in online exam? Dr. Mahmood, please, you raise the hand to add. Dr. Mahmood, to add something.
No, thank you, Doctor. Just I want to comment. This is very right. Yeah, as you said before.
Thank you, Doctor. Thank you very much.
Yeah, really, thank you so much, Doctor. Thank you.
So we are very happy to get you here, Doctor. If no more discussion, actually it is our pleasure to share with each other and those who are appearing for the AKT. And I have to announce very big thing today for you. I hope you can share with your colleagues also. And again, thanking our participants, those who appeared at the exam and passed, as well as who didn't pass, don't worry. I'm going to show you and inviting you to join with this group, especially for the AKT, in the meantime, we updated our YouTube also, only for the exam preparation. Exam means MRCP and MRCGP too. We are main target. So you can see the YouTubes. This is well organized and already we developed our improved, rather to say, website actually was were with us before, but recently we developed it. We will focus it in the group and we organized the website in different categories. So you will see, and initially those who didn't register with us, there are many important free lectures and discussions are there. You can enjoy it. It will guide you. Even you are very excellent in your preparation, only reading something, your chance will be high up to pass the exam. But again, as our colleague said, that actually mentoring is important, supervising is important to make your path very easy, clear, and smooth. That is the thing. It is very, very true. Otherwise, you can get a basic idea from our website. I will let you know. It is very simple, doamsbd.com. Still, there is something remaining to finalize it, but available in the air, doamsbd.com. You can see and you can suggest also to improve it further. And this is our module content in the DC already you have seen. There is many buttons are there. You can click so that you can see the detail in the group. And this is our already ongoing this thing, this package and other thing. But in the meantime, we have done something universally, not only for AKT examinee, but this slide already happened, this session already happened, the trap and rescue in the AKT and the OSCE. Trap, how question trap is created, we identified and discussed. You could see, for one example, we couldn't make for each and every system, each and every disease, but we started this thing. Hypertension in general practice. There are different trap of questioning. If you, I think Dr. Javed and other, actually, if possible, we can add this thing in our module in future as a totality, not very sporadic, single one or two. It will be time consuming though. This is our plan to add in the module in future. How the questions are distorted, how questions are puzzling you. For example, if you have time, please, you can see in the YouTube this thing available in our YouTube. Similarly, other than hypertension, the learning by role play, though it is not directly related with AKT preparation, but important for the OSCE, but the design content useful for AKT OSCE candidate as well as the general practitioner also. How will you talk to the patient? How will you gather the data to reach a correct diagnosis and management? So these are sporadically done, not very sequentially, because it's very time consuming. So myself, by the mercy of Almighty, trying my best to spare my time enough, which will be suitable for you. Thank you very much. Thank you
Thank
very
you,
much.
sir. Thank you.
See you.
Thank you.
Thank you, Dr. Ismail.